I'd like to introduce to you Jennifer. And Jennifer, this is a very informal talk, and you're a new patient for us.
Yes.
And this is the first day you've been here. And you told me such a very interesting story that I asked if you would please tell other people and other patients, because I think you can help them, because I think you've got a secret, and I'm going to ask you a little bit about that secret, because I think it's very beneficial. Sure. And where I'm going on this is weight loss. And one very important fact is if you have a knee injury or knee arthritis, you're going to gain 20 to 30 pounds, and maybe even more. And it's because you obviously have decreased your activity, you're decreasing that burns calories, and so you start putting the weight on. And then I think in our society in America, I think we all tend to maybe eat a little bit more and not exercise, exercise enough. So it is a very significant problem. And then the second fact that I mentioned to you is for every pound you weigh, you put 4 pounds on your knee joint. And when you climb stairs, it's 6 to 7 pounds. So if you were to gain 20 pounds, you literally are putting 80 to 100 pounds, and those are real pounds. If you've ever tried to lift 50 to 80 pounds, those are real pounds. Now, Jennifer, you have a right knee injury, and you do have arthritis, and she has had an arthroscope a few months back, and it does show that she has major areas of loss of cartilage, and we did review that with you today.
Yes.
And the second fact that you're interesting is that you're 40 years of age, and you were told that you had to kind of live with your problem.
Yes.
And your problem, how far can you walk before you have pain?
Probably from the car to the door.
And that's not something that's very nice to live with.
No, not at all.
And you're 40, and so you have pain really with every activity,
yes.
Don't you?
Yes, I do.
And
swelling.
That's why you're here.
Yep.
And how did you feel when they said, there's nothing we can do for you, you're going to have to live with that?
Not great, very frustrated, because I feel like there's something that can be done.
And you've had some family members that have had knee replacement.
Yes. Yep. And it's been very successful.
And it's doing very well.
Yes.
And the question you would ask is, well, if it does very well for someone in their 70s, why can't it do very well for someone in their 40s?
Absolutely.
And the answer to that, I told you, is that's absolutely correct. And now knee replacements are so successful that we do them at a much younger age. But I also told you that everything has to be perfect.
Right.
Because we don't want to have a chance that we're going to have to go back in and do surgery at an earlier time. And so modern knee replacements, 90% are still in at 20 years. So, and we expect they'll last much longer.
Right.
But the one thing that must be right is the weight. And do you mind telling us how much weight you've lost since June 19th when you started your diet?
I've lost 52 pounds.
And you haven't been able to exercise?
I have not been able to exercise.
And how did you magically do that?
Well...
And you said you did some research.
I did. I was obviously gained quite a bit of weight, not able to exercise. So I just started doing some research on different foods and carbohydrates and sugar and fats. And I found that a lot of times people are having success with a low-carb, low-sugar diet.
And I said that's absolutely right. So you essentially knocked out all the sugars and carbohydrates.
Exactly, yeah. Very few. I've limited myself to 20 grams,
20 grams
of carbohydrates,
and
10 of sugar.
Mm-hmm. And you stayed a little higher on the protein side.
I did a lot higher on the protein side, which is good because if you eat a lot of protein, it does make you feel fuller. You're not, binge eating or anything like that. And once you start it, I mean, if you can get through the first 2 weeks, I was home free.
And tell me what you thought in the first 2 weeks, the trouble you had staying on it in the first couple of weeks.
Well, the first couple of weeks were hard because it's like putting your body through detox. Your body's used to getting all this sugar and carbohydrates. And when you completely cut that out or lower it to the amount that I did, it was like going through withdrawal. I had a lot of headaches, because you feel like you're just starving your body, but you're not. You're retraining it.
Mm-hmm.
And after about 2 weeks, I didn't have any more headaches. I was getting used to it. And I decided that I would not check my weight until once a month.
Mm-hmm.
So at that month, I realized this is working. I've dropped some weight. Let's see how this goes.
Let's see how far you can go.
And
And the craving, how's the food craving now?
actually, I don't crave pasta, potatoes, bread, sugar, cake, candy. I don't even crave it anymore.
That's the secret though, that's the amazing story. So I asked you just to give us an example of the food. You'll have a very light breakfast.
Right. I have probably like a protein bar, low carb protein bar.
And I kind of kidded you, I said you didn't have all the potatoes and cereals and other things.
Nope, not at all.
But then at lunchtime, you do add some protein?
Yes. I have either sometimes another protein bar, I have eggs. I can either do scrambled or an omelet. If you do the research, you can see that you can add peppers and things like that to make it more interesting for you. Tabasco sauce is great.
And vegetables and
yeah,
fruit?
Broccoli, grilled chicken, even some red meat because there's no carbs.
So at nighttime you can
right.
treat yourself a little bit more.
Right, and then I did read where, uncured bacon, no nitrates, and uncured salami is a better way to go when you're trying to do something like I've been doing. So, I eat that. I'll have some, and cheese, you can have all the cheese and butter you want.
Yeah, we tell...
it's good fats.
Yeah, they're good fat. We tell people to be careful with that also, though,
Right.
to keep that in moderation.
Yeah, absolutely. And after the first couple months, I also read where it's good sometimes to give yourself a cheat day and just kind of eat whatever you want. And that's good because it kind of re-kicks your metabolism, restarts it. So you don't just plateau. You don't want your body to get too used to it. So it's actually very effective to have a day where you eat whatever you want. But for me, I'm even still conscious about it.
Well, that's a really good secret. And the one thing we would add to that is that we'd have our therapist add some sort of physical activity. And even if you can't be on a treadmill or other things, you can do upper body exercises. And you can do yoga, you can do exercise on the floor. So there's a lot of things that we can do. So I think that's really an amazing story. And I appreciate, Jennifer, you telling us that story, because so many times patients want to do better, and you decided that that was just something you could do. And you're your own internal coach, aren't you?
Yeah.
You have to have that willpower
You do.
to do it.
You do. Yeah.
But,
I mean, it's your choice. Even going out to restaurants, you have a choice to eat that bread or not. I don't.
That's great. Well, that's a great story. And the answer to that is now, Jennifer's now in a position where as she continues to lose weight, and we are not going to do the knee replacement immediately, we're going to look for that weight to come down a little bit more, but then we're going to set a number and have her do the total knee at that point, and then she can eventually lose another 15, 20 pounds and come down to an entirely normal BMI.
Yeah.
And then you can really restart your life and have a better knee.
I look forward to it.
Good. Is there anything you want to say about our interview or what's gone on here today?
No, I've been thoroughly impressed with everyone, how they've treated me, how you've treated me, and been very honest. I'm looking forward to working with you and anybody else in rehab and with this establishment.
Good. Thank you. Thank you very much, Jennifer. Thanks for coming in.
You're welcome.